When veterinarians first heard about the outbreak of CIV and they heard of it being a different type of influenza, or H3N2, they were instantly bombarded with questions from their pet owners.
When people called us and needed information, we sent it to them or talked to them. We did everything we could. That was the whole background to the outbreak, was we were caring for the patients on one end and disseminating information and helping with others on the other.
I teamed up with Merck Animal Health through the platform VETgirl, which is an online continuing education platform. So what we did was we created multiple online lunchtime webinars where veterinarians, veterinary technicians could literally watch an online video or an online webinar. They had the chance to interact and ask questions, and they could hear from immunologists, they could hear from criticalists on what signs to look for with CIV, what specific tests they needed to do in order to diagnose it, and how to treat their dogs or their patients for CIV. And we had over 1,000 people on the first webinar.
For many veterinarians, it was like they were at war. That if we didn't help to get the word out, many more dogs would have been sickened and many more dogs would have died. I'm very privileged. I'm able to communicate to pet owners, millions of pet owners really. So through my newspaper columns, through my radio shows, and through my blogs, I was able to keep people up to date, not only pet owners, but veterinary professionals as well.
In order to be able to provide timely information, we also wanted to team up with veterinary medical associations from different states to make sure that that continuing education counted for the veterinarian to be able to get online veterinary continuing education credit. Since veterinarians were on the front line of answering all these pet owner questions, they could provide the right answers or the medically correct, most up-to-date scientific updates that we had.
We did many Eblasts to our clients, and I basically would write emails on what I would find out real time, and we'd send out 2 to 3 times a week updating our clients on how long it sheds, what signs to be looking for, where you could be picking this up, all the kind of questions that we would get.
Merck was great. They helped out the veterinarian caring for the patients. They helped out the owners caring for their pets, and they disseminated information and served to coordinate different parties to get the message out. During an outbreak, helping get accurate information out to the public is imperative. It's part of what we did as a veterinary community with social media, with our websites, with the traditional media, just getting the truth and the information on how to care for your pet and prevent disease. That was the key to breaking this thing.